Hi everybody, I'm Katie Gordon. I'm a healthcare expert and a consultant to the NHS, and I'm now a recently published author of a book called Beating High Blood Pressure. Many people ask me in my work environment, how would I know if I have high blood pressure? And the answer is you don't, and that's why it's so important to make sure that you get your blood pressure checked regularly. So anybody really over the age of 30, women who are pregnant will need to have their blood pressure checked by their GP. If you're feeling a little bit overweight or a bit unfit, it's always a good idea to have your blood pressure checked relatively regularly. So I would say every 5 years, unless you know that it's a bit of a problem, might be slightly borderline high, then you ought to have it done more regularly. But it's so important. It's known as the silent killer, and that's exactly what it means. You may not know you've got high blood pressure until actually you've dropped down dead or you have a stroke. So if you're one of those people that are in that target group, I'd say get yourself down to your doctors or to your local pharmacy where they take blood pressures and get your blood pressure checked. Know what your numbers are. Know if it's normal or if it's a bit raised. There's so much you can do to help yourself to bring your own blood pressure down, and there's lots of tips and advice in this book, and obviously from the practice nurse, so that you can actually bring your blood pressure down and bring it under control yourself without necessarily having to have medication. So if you want any more tips and advice about how you can actually control your blood pressure yourself and lower it if it's a bit high, go to my website, katiegordon.com, where you'll also get extracts from the book, tips, and you can also post me questions. And otherwise you'll be able to get this from my website, cocreatingbalance.com. Thank you.